Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Grace Asiri, Assistant Producer of Public Health on Call. The Invisible Shield, a new 4-part documentary series on PBS produced by Radical Media and made possible by Bloomberg Philanthropies, explores the unseen public health infrastructure that supports modern life that we often take for granted. In this special episode from Bloomberg Philanthropies' Follow the Data podcast, Catherine Oliver talks with Josh Sharfstein and Dr. Sandro Galea, Dean of the Boston University School of Public Health. They discuss the beginnings of their careers, the critical role of data collection, and the biggest challenges in implementing public health policies. Here's Follow the Data.
This is Lindsay Smith-Rogers. It's been widely noted that pulse oximeters, devices used to read blood oxygen levels in hospitals and at home, are far less reliable for people of color and especially darker-skinned patients than for white patients. The error results in readings that are falsely normal, creating the potential for clinical staff to miss life-threatening complications. On Monday, July 8th, we're launching a special 3-episode series. That's all 3 episodes available at once, exploring the issue of racial bias in pulse oximeters. We'll look at why this long-standing problem only caught the nation's attention in recent years, despite the fact that there were known issues that were largely ignored by manufacturers and regulators. We'll also dive into the history that led us to the flawed devices that are used in hospitals everywhere and available for consumers on the market today. Finally, we'll hear from advocates from across the medical spectrum, including patients, clinicians, students, and scholars, about where we go from here to demand equity and ensure that it's built into the future of medicine. Look for this special series on Monday, July 8th, wherever you get your podcasts, or go to publichealth.jhu.edu/podcast.
Welcome to Follow the Data. I'm your host, Catherine Oliver. Public health saved your life today, and you probably didn't even know it. From vaccines to seatbelts and no smoking signs, public health measures have significantly impacted our lifespans and our quality of life for decades. And yet the work itself is often underfunded, undervalued, and misunderstood. The Invisible Shield, a new 4-part documentary series produced by Radical Media and made possible by Bloomberg Philanthropies, explores the hidden public health infrastructure that makes modern life possible. Featuring interviews and insights from public health leaders and global experts, the series examines the field's major achievements and the dedication of the public health sector in times of crisis. Today, I'm sitting down with 2 public health experts featured in the Invisible Shield. Dr. Sandro Galea, Dean of the Boston University School of Public Health, and Dr. Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins Bloomberg School of Public Health. We discuss how they started their careers, the importance of data collection, and the biggest obstacles to implementing public health policies. Dr. Josh Sharfstein, I'm going to start with you. In our series, you give the line, public health saved your life today, and you didn't even know it. Now, I heard you say that, I think it was in the summer of 2020, we were at the start of the global pandemic, and I was listening to you speak to a group of folks at Bloomberg Philanthropies via Zoom. It was a crazy time. We were all searching for direction, information, and for guidance. And it just struck me that it was a simple concept. Public health saved your life today, and you didn't even know it. That was the genesis of the series, The Invisible Shield, because we thought no one really understands what public health is, the importance of its role, and certainly the importance of it because of the pandemic. What prompted you to pose that question and to really reflect on it in that way?
Well, that is a line that I did not come up with. That's a line that has been bouncing around public health for a number of years. And often it's stated in frustration. Like, people don't appreciate public health. They take it for granted. It saved your life today, but you didn't even know it. And our budgets are much smaller than, say, the healthcare budget. People often overlook public health. They don't think about the challenges facing the public health workforce or the public health agency. And it's not because what we do is not important. It's because what we do is often hidden. Now, that changed in the pandemic, right? The pandemic suddenly made it all visible. And it was a role, to a certain extent, we weren't entirely prepared for. A lot of people go into public health being excited to work behind the scenes, not really seeking the limelight. And then all of a sudden we were pushed forward for public health. It turned out to be a very stressful moment.
Dr. Sandro Galea, you're a physician, an epidemiologist, a teacher. What inspired you to focus your life's work on public health?
I think, like many of us in our generation who are in public health, I started off in clinical medicine. I started off as a doctor. I'm trained as a primary care emergency physician. And it was while working as a physician that I became aware of the shortcomings of clinical medicine. And that is not, sometimes I worry when I say that that's construed as one thing versus another. It's not that at all. I have a deep, healthy respect for the importance of clinical medicine for my own life and for all our lives. But I learned that clinical medicine is about healing and getting people back to healthy when they're already sick. And I really was interested in figuring out how to keep people healthy. And perhaps this came to me in the most acute way when I was working in Somalia. I was working as a physician in Somalia, pretty remote area. I was the only doctor around for many hundreds of thousands of people. And I think I was doing good clinical work. I really think I was helping people and saving people's lives. And paradoxically, the effect it had on me was, yes, but when I leave here, nothing's really going to change. So there must be a way to change, to figure out how to create health better. And that, for me at the time, having been trained as a clinician, I really did not know what that was. And that prompted me to go back to graduate school to learn public health.
How do different geographies approach public health? And do you think that someone's geography affects his or her opinions on public health issues?
I'll break that question up into two. I think the first one is you asked about geographies. There's a term which I think has gained traction in public health, which I like, which is this notion of geographies of opportunity. That depending on the happenstance of birth, you can be born into a safe neighborhood. You can be born into a neighborhood where everybody around you is well educated and sets you on a path of financial security and a path where you're going to accumulate the assets that generate health. Conversely, you can be born in a very different neighborhood. And those are unfair and unearned advantages or disadvantages that create health or not. The second part of your question is, how can your geography affect how you think about health? And I actually think that's also the case. I mean, we know from evidence that people, for example, who are in geographic areas where they see that their health is not doing well are much more likely, for example, to vote in elections for people who are more interested in sort of tearing up the playbook and starting over. And in many respects, that makes a lot of sense, right? If you feel like you are in a place where through no fault of your own, your health is getting worse, you are going to be much more inclined to want to try something different.
Dr. Sharfstein, from increasing life expectancy to eradicating smallpox, our series, The Invisible Shield, spotlights public health's major achievements. How can examining the history of public health help us tackle present and future health challenges?
Well, I think it has to do with this concept that a lot of what public health does is hidden today and people don't really appreciate it. I think looking to the past helps you appreciate this a little bit more. Clinical medicine, like Dr. Galea has been talking about, really hasn't been around that long. At least clinical medicine that actually works hasn't been around that long. By comparison, public health has led to enormous strides in health over the past few centuries. From the smallpox vaccine to clean air, clean water, insights about housing, insights about safe milk for infants, really radically changed not just the life expectancy, but frankly, the nature of childhood. There's a great book by Perry Class that talks about all the gains in public health that made it possible for parents not to just expect that they would have kids die, that it would become a very rare event. And so as you appreciate the history of public health, you appreciate how important public health is. I think you also appreciate some of the challenges facing public health, some of the things that public health did wrong in the past. And that also allows you to have a more nuanced view of what can be done today. If like your entire frame of reference is like 1980 to the present, then you're comparing the explosion of healthcare with a very underfunded and haphazard public health system. But if your frame of reference goes back to the Middle Ages, you appreciate how public health was fighting the Black Death before healthcare could really get its shoes on.
If I may just add to Dr. Sharfstein, surely one of the greatest, if not the greatest achievements of the human species has been the doubling of life expectancy in the past 150 years. I mean, until 150 years ago, you could expect to have a life expectancy in wealthy countries of mid-40s. Now we can expect to have life expectancy in mid-80s. And that is in large part a product of public health, as Dr. Sharfstein mentioned. And that I feel like sometimes is not well understood.
Disinformation, misunderstanding, skepticism of science, and distrust of government. These are all things that we hear about in the series. We read about in the newspapers over the last few years. It's just 4 years now from the start of the pandemic. What is the connection between public trust and public health?
Public health has to operate at the level of policy and structural change in society. And to do that, one needs trust, one needs buy-in, that the general public is willing to come along with the structures that need to be put in place in order to make sure that people have freedom from unnecessary illness. And a lot of that comes from trust. A lot of that comes from buy-in into the project of being healthy. And I often feel like once people understand that what public health is trying to do is to try to generate as much health as possible for as many people as possible, in many respects, how can people not get behind it? Everybody wants to be as healthy as possible for as long as possible. Everybody wants their kids to be as healthy as possible for as long as possible. So our job is to create those conditions and to bring people along with that project.
And it's important to communicate that and to connect with communities. And we saw several examples over time where that was true. Dr. Fahey, former director of the CDC, reflects a lot on smallpox eradication and the work that he did through the years. He argues that culture always wins. He stresses the importance of working directly with communities to find out what do people want and what approaches might promote a more inclusive public health landscape. Dr. Sharfstein, some thoughts on that?
The Institute of Medicine defined public health as what we do collectively to assure the conditions under which people can be healthy. And there's the we and collectively. That's really important to public health. It's really part of the definition. And that means that people have to be interested in the goal. They have to be part of the solution for efforts to be successful. And I think we did see a lot of this during the pandemic. We saw communities really fighting misinformation, coming together and figuring out ways to explain to their friends, neighbors, family the importance of vaccination, the severity of COVID infection. And when that happened, we really saw progress. We erased some pretty significant disparities that were early on in the pandemic. But yet there are still a lot of places that weren't able to do that. They weren't able to come together, and distrust, like you mentioned, Catherine, was definitely one of the reasons. And when people don't trust, then you don't have any what we do collectively. You have what I think I need to do. And in order to figure that out, I'm going to look on my favorite social media platform that could be telling me something totally wrong, could be twisted because of polarization. It's interesting to consider that through all of public health, there has been opposition. We have opposition today. That is not surprising, but the tools that the opposition has with social media, with organizing online, with the kind of vitriol that they can accumulate is very, very strong. So I think that the issue of trust, the challenge of trust, remains extremely important and very challenging today.
Dr. Sharfstein, you've served as the secretary of the Maryland Department of Health and Mental Hygiene and as a commissioner for health for Baltimore City. What have you experienced? What have you seen some of the biggest obstacles in advancing, implementing, and enforcing some of these significant public health policies?
Well, I think we've talked about how people don't have an intuition about public health. Like they might have an intuition about the fire department. The fire department, the alarm sounds, the trucks come, everybody knows what the fire department does. Public health is a little bit more amorphous for people. They don't really understand on a regular day what an entire public health department does. I actually found that the more they understood that, the more supportive they were, even of different kinds of policy changes like Dr. Galea is talking about. I'll give you an example. When I was the city health commissioner, everyone understood restaurant inspections. And people would call about restaurants. Sometimes elected officials would call because they were upset that we had closed certain restaurants. And then I would read them the inspection report and there'd be a long pause and they go, "So why didn't you close that one sooner?" So people understood that, and they understood that we were doing a service for their constituents. Now, I also worked at the state. We inspected assisted living facilities. We did things that really mattered for people. And the more people appreciated that, the more they were behind us in other things that we were doing, including things kind of unrelated, like trying to get more addiction treatment or changing healthcare payment. Then you go to the Food and Drug Administration, where I worked at the federal level, and there's a lot less appreciation about what the FDA does every day. And the FDA, I think, partly as a result of that, is a political football sometimes. And so I think documentaries like The Invisible Shield play a really important role, because I certainly have found the more people understand what public health does, the more likely they're willing to give a listen to ideas that can make communities a lot healthier.
Dr. Galea, your research largely focuses on anxiety disorders, substance abuse following mass trauma events like September 11th or Hurricane Katrina. What are some steps that government leaders can take to address and prevent such public health crises?
There are two ways to address that question. Number one is we know that after traumatic event experiences, be they mass trauma or individual trauma, the people who already are more disadvantaged are the ones who suffer the most. So we know that people who already are facing financial stressors, social stressors, do not have enough resources to look after their children, who live in neighborhoods that are under duress, are the ones who bear the brunt of mental health problems after traumatic events. So the first thing we should be doing, and this speaks a little bit to what Dr. Sharfstein was saying, is see one of the roles of public health as encouraging an investment in building healthy neighborhoods, healthy environments where everybody can actually be as buffered and as protected from stressors and traumas as possible. So that's step A. Step B, once a traumatic event has happened, there are a number of approaches that one can take to it. One of them is actually generating awareness of the real risk of mood anxiety disorders and creating opportunities, which the web allows you to do very efficiently, for what we call stepped care, for people to diagnose themselves, to intervene to help themselves, and then to have resources that are available to them in the form of people who can actually help with mental health if they need it. But all of that, what I'm saying, and I think it dovetails very nicely, although it's a specific example, with what Dr. Sharfstein said, that is all the work of public health. It is building a community where people in it are resilient and paving the way for a mass approach to providing services to people. All of that is public health, leading then to the opportunity for medicine to do its part for people who are sick.
From recording mortality statistics to identifying the spread of diseases, data has been an essential public health tool. How has data collection changed over the years, and how has it improved advanced public health?
Data is absolutely central to public health and to epidemiology, which is a core discipline in public health, because it's a very outcome-oriented field. We want the population to be healthier. In order to have that happen, we have to be able to measure what health is. We have to know who's dying. We have to know differences between groups. We have to be able to pinpoint geographic areas with particular problems. As the series makes clear, maps sometimes can be incredibly influential. There's the map of the pump that was responsible for cholera in London. It's sort of a place for people in public health to go and check out. Data is extraordinarily important. But one of the things I would say, Catherine, is that we unfortunately, as part of the weakening of public health in this country, we have lost access to data that really helps public health do its job. During COVID, people were accustomed to going online and seeing what was happening the day before in their city with COVID, how many hospitalizations, how many people in the ICU. But there are not that many issues where we have that kind of data. We don't have data like that on substance use. Overdoses are often on a tremendous lag to figure out. We don't have that data on infant mortality or maternal mortality. And so really the revitalization of public health, which is really at the core, I think, of the documentary, that we need a stronger public health system in this country, improving the data systems really is a central component of that.
First responders, doctors, public health officials, understandably were burned out from the pandemic. But there's some evidence to support that young people are inspired to pursue careers in public health now. I remember after 9/11, there was a big push for young people to consider careers as cops or firefighters, just inspired by what their city, their country had gone through. Dr. Sharfstein, are you seeing an uptick in applications at JHU as a measure, as a data point to reflect on this?
This year we are, but let me say that there's been a little bit of a paradox, and I don't know if Dr. Galea is seeing this also in his world, but on the one hand, people who were in public health during the pandemic had a very hard time, many of them, I should say, and they were calling, saying how frustrated they were, how they were being attacked, how they didn't have the experience of firefighters and police officers that you're talking about after 9/11. They had the experience of people really going after them and calling them all kinds of names and throwing misinformation at them. And they were very, very frustrated. I would then meet with a student who had just so much energy, so much vision, seeing the ability of public health, not just to help people one at a time, but to improve the health of communities, to address inequities, and just an incredible force for improving their world. It was a paradox. I was hearing about the frustration, but also feeling the enthusiasm of young people. We have to find a way to bring those together. We have to get those young people into those positions. We have to expose those people who feel unsupported to the energy and optimism of young people. But it's a paradox and it's a challenge for our field right now.
Yeah, and I'll echo that. I mean, I see the exact same thing. And, perhaps it's not a paradox if one leans into the optimism and promise that comes with people who are early in their life stages. And I actually think COVID was this enormously difficult moment for everybody in public health. And I think the young people who we see coming into our program, they see that, they recognize that. But I think they're almost energized by that because they saw it was hard, but they also saw the immense potential of public health. In my latest book, I wrote the phrase, COVID was public health's finest moment. And I believe that. And I think that is right and immensely motivating. Having the privilege of being in a school of public health like Dr. Sharfstein is, one of the things that is immensely renewing is seeing wave upon wave of young people coming in, committed to this mission. And now, post-COVID, we are seeing that more than ever.
And what are you advising your students as dean at Boston University School of Public Health? Is it get the practical information and education in the classroom, but then go out in the field and have that experience as well, maybe in the form of an internship or volunteering? What do you think is the right kind of mix for doing the schoolwork and then having the practical experience?
All our students, as do all of the students at JHU, or Dr. Sharfstein is, they all do a practicum, which is essentially an internship. So that's built into the program. I think my overwhelming advice is, number one, commend them on their good judgment. I think public health is an important aspiration for students to engage with. And I think it's something that will be satisfying for them throughout their lives. Number two, I encourage them to do the hard work of learning the foundations of public health, learning the history that public health came from, learning the approaches and methods that will allow them to be excellent public health leaders and professionals. And because when students come to graduate school, which is what we're talking about here, it is a privilege that they spend the time doing that. And I want to make sure that the next generation of public health professionals are outstanding.
I think that is exactly right. And I would add, I tell them about the internet question, would you rather be invisible or fly? And people vote, I'd rather be invisible, I'd rather fly. And I tell them that for many years, public health has chosen invisible, or it's been chosen for public health to be the invisible shield to some extent, or been put in that role. But I think post-pandemic, that's no longer possible. And I tell the students that it's their job to fly, that we need to have a public health that's visible, public health that people can appreciate, and that the work that they do and the sense of mission that they bring to it is something that they need to share with others too.
We've had the old playbook and we have a new playbook. We're more aware of the importance of using data and technology. We have more resources now, but public health is still underfunded and undervalued. So what's our call to action right now? We're in an election year. So what's your advice to students or to elected officials out there?
Well, I think it wouldn't hurt to start by watching The Invisible Shield to realize how important public health is and to act like that in the political realm too. We should be supporting the services, the resources, the people who keep us alive and allow us to have the kinds of lives that we want to live. I think a key point that I would make, particularly for people who may not come as naturally to public health, might have some suspicions about public health. The way to think about public health is it is the field that allows people to live the lives they want to live. It, to some extent, makes liberty possible. It's hard to have liberty if you are very ill or dying. But if your family is healthy, you can decide what you want to do with your life's work, with your time, with your money. All of those flexibilities come off a base of health. And it's public health that makes that base strong. I think we learned that during the pandemic. We see that on many other issues. And it's really important for there to be some degree of social consensus that we need that base of health. You know, the United States really suffers in its life expectancy. It suffers from all the inequities that we have. And it holds back the ability of many people to really live the lives they want to live. And investing in public health really can make that change.
Hard to believe that it was 4 years ago that it started. Dr. Galea, your reflections on lessons learned and what you are sharing with your students and colleagues.
I think in some respects, almost too early to be definitive about lessons learned. I think the one thing I feel certain about is that it's time for us to start reflecting, looking back. People have been writing about things we did well, the things we did not do well. I think it's going to take us several more years to really grapple with that. And I think that's okay. Look, COVID was, we hope, the sentinel event in our lifetime, public health crisis. There's a lot to learn from it. But I still think there's a lot that we can take out of the moment. And my advice to students is, this is the right moment to engage in public health. This is the right moment to ask questions about how we should do what we do and how we should do it better, and to commit to the field and to say that we are committed to building the best possible public health. And there's plenty of space for a lot of people to have ideas about what we should do better. And I look forward to figuring out what those ideas are.
What are you most optimistic about?
Oh, that's easy. It's the people coming into the field. Dr. Sharfstein and I mean, I'd like to think we can still make some contribution, but the people who are coming after us are the people who really matter.
And Josh, what's your biggest concern?
Well, my biggest concern is that all of the distractions and all of the challenges facing society will make it very hard for public health to break through. That instead of being in charge of our destiny to actually have the impact that public health can have to turn around American health, instead we'll sort of be the tail of the dog being wagged, the dog being polarization and tribalism and misinformation. And it'll be very hard for people to really hear and understand the value of public health in that context. I think that's a pretty real fear these days. But I am hopeful for the same reason that Dr. Galea is. I believe that there is so much value that at the core, everybody loves their children. I'm a pediatrician, you know, everybody loves their children. People want health for themselves and their families, and that hopefully we will be able to see our way through the storm that we're in to get to a point where people can watch a documentary, understand the value of a critically important social good, and be willing to work with it to make a big difference.
I first heard this from a former dean at JHU, where Josh is, which is, public health is an aspiration. And I think that captures well how I feel about public health. It is a vision of a world where everybody is as healthy as can be, where everybody's children are as healthy as can be. And it is a very compelling vision. It's hard to find people who disagree with that. People want to be, and they want their children to be as healthy as can be. And I think if we can lean into that vision, we can tap into that vision, we can tell the story of how public health helps achieve that vision, that is then something that's worth pushing forward. That's something that's worth dedicating one's life to.
Thank you for your time today and for your dedication overall. I really appreciate it. We hope you enjoyed this episode of Follow the Data. Bloomberg Philanthropies is committed to helping saving millions of lives by spreading solutions that have been proven to work. Many thanks to Dr. Sandro Galea and Dr. Joshua Sharfstein for joining us. As always, the views of our guests are entirely their own, and Bloomberg Philanthropies hasn't independently verified any of the statements made by this episode's guests. If you haven't already, please be sure to subscribe to Follow the Data. This episode was created by Arden Lieb, Devin Alessio, Minnie Kim, and Stephen Chiapecca. Be sure to watch the Invisible Shield series. It's now streaming on the PBS app or pbs.org. You can learn more about Bloomberg Philanthropies' efforts to tackle public health issues like tobacco use, road crashes, non-communicable diseases, and much more by following us on Twitter, Facebook, Instagram, Threads, LinkedIn, and YouTube. As our founder, Mike Bloomberg, says, if you can't measure it, you can't manage it. So until next time, keep following the data. I'm Catherine Oliver. Thanks for listening.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.